Hello, everyone, and welcome. I'm honored to have Dr. Diane Hennacy Powell as my guest today. Dr. Diane Hennacy Powell, MD, is a Johns Hopkins-trained neuropsychiatrist and neuroscientist, former Harvard faculty member, and an award-winning author and clinician. She has worked internationally and currently has a private practice in Oregon. She began studying autism in 1987 when she spent 6 months with Sir Michael Rutter at the Institute for Psychiatry in London. She is also an expert on PTSD and co-created psychiatry programs for survivors of torture international and the McCandless Women's Center in San Diego. She has served as a member of a think tank on human consciousness at the Salk Institute and as the director of research for the John E. Mack Institute. Her current research focuses on investigating parental reports of telepathy and precognition in children with autism. Her lay publications include her book, The ESP Enigma, A Scientific Case for Psychic Phenomena, and the 2007 Shift Report, Evidence of a World Transforming. Welcome, Diane, and thank you so much for joining me today to discuss your amazing work in the autism and special needs community.
Oh, thank you, Gilda. It's a pleasure to be here, and hello to the audience.
Okay. Well, so tell me, let's start out this way. There's an old saying, when you meet one person with autism, you've met one person with autism. So then, how do you define autism? What are its presentations, and what do you feel its causes are?
Well, I agree with you that that saying really sums it up. And the reason why is that there is so much variation in not only the way that these children present who are diagnosed with autism, but also if you look at their brains. They don't have... it's not that there's a particular part of the brain that has the wiring that has been, it's misfiring or something like that. It's really such a blanket diagnosis based on just a couple of fundamental things. A child who is not developing socially in a normal way is one of the criteria. And another one is that there's something that is unusual about their language development. And when I first started studying autism, which was 40 years ago, that was when it was so rare that 1 in maybe 10,000 children had autism. And my mother was a special ed teacher, so that's how I first heard about autism. But it was so extremely rare, and the children couldn't really communicate. They were in just their own little world, which is what the term autism means. And so when I went over to London to work with Sir Michael Rutter, I saw these cases that came from around the world, and a lot of them were these children who were born different. They didn't have the social smile, for example, that you expect to see an infant have. And they just didn't develop language in a normal way, and it was very, very peculiar use of language. So, for example, they would use the pronoun differently. They would say, if they were referring to themselves, they would say you, because that's what they heard other people say to them. Other people would refer to them as you, and so and then they'd use the pronoun I to refer to other people, because they'd be hearing other people referring to themselves as I. So that kind of quirky misuse of language, and if you corrected them, it didn't matter. They still would do that. They still misuse the pronouns. Or another example of how that language is aberrant was that they would have what's called echolalia, which is that if you said something, they would repeat exactly back to you what you just said to them. And so it was really hard to have a conversation with them. And so that's really when I think of autism and language issues, those are the kinds of things that I think of. But then what you also have is this form of autism that's called regressive autism. And in that instance, you have a child who is developing normally and reaching their milestones, and then somewhere, typically it's around between the ages of 1 and 2, almost always before the age of 3. So during the time period when language development is right at its peak, where these children are just, that part of their brain is just really being rewired while they're acquiring language, that part of the brain is what starts to shut down, and it gets inflamed. And there's damage that's done to the section of the brain that's involved in language acquisition and expression. And these children stop speaking, and they become what people call nonverbal autism. And if you really look at what's going on with them, what you see is that it's not at all like the language difficulties that I just described earlier. It's actually that they can't get the musculature to work properly for them to communicate. And these two types of autism are so different from one another that, to me, it really doesn't make sense that they're lumped together. It really confuses the picture. And when autism was first discussed as a diagnosis back right around the time of World War II, when Leo Kanner saw these children who had the classic type of autism that I just described, that I saw with Sir Michael Rudder, where they were so into their own little world. They would maybe be sitting in the corner playing with blocks or playing with something in a repetitive way. And they're more interested in that than they were in what was going on with their parents or the people in the room. That's what people thought of as autism. And oftentimes those children turned out to be exceptionally bright. And in Kanner's first description of 11 children with autism, 9 of the children really fit into that category, and several of them were the children of psychiatrists who were at Johns Hopkins, where Leo Kanner was a professor of psychiatry. And the other two, if you look at their histories, one of them developed autism, was developing normally and then had regression, and it was around the time period of having the smallpox vaccination. And the other child, it was after having an infection that caused the child to have inflammation in the brain. And so from the get-go, we've had these two types of autism that with the DSM-5 were lumped together as autism spectrum disorder. With very different causations, very different clinical scenarios.
Yeah, it sounds that way. So then if each case is so different, how can one determine the most effective treatment or support mechanisms for each individual?
Well, that's one of the issues, and that's one of the problems with finding a treatment. And so many of the treatments are just, they're, like, for example, drugs that make the child somewhat drugged so that they're not acting out as much, and behavioral techniques that might help the child in terms of just trying to get them to behave more normally or to learn how to function in their body. It's more like occupational therapy. But it's not getting at the root cause of what caused this in the first place. What can we do to try to help the child recover? And the reality is that there have been many case reports of children that have been diagnosed as being autistic, and in fact the doctor said that this child should be institutionalized, that this child will never amount to anything. And the parents fought against that, and the child is actually living a fairly normal life today. And what one great example of that is Marcia Hines' son Ryan, who she was told should be institutionalized, and he's now an aerospace engineer.
And that's not the first time I've heard of a story like that, by the way, is parents who became their child's strongest support mechanism and advocate and wouldn't take what the doctors and other people were telling them, and the children turned out to be absolutely amazing in terms of their capabilities and talents and intelligence levels and so on and so forth.
Yes, and that's right. And so many people don't realize that the diagnosis of autism is independent of IQ. So they just assume that they are mentally retarded, and that's not the case at all.
Right. A common misconception is that autism has an effect on intelligence. Correct. I mean, what are
that's right.
Right. So what are the things that autism does have, an effect on in most of the cases, and can you speak to the intelligence of many people who are on that spectrum?
Well, so many of the people who are on the autism spectrum actually have superior IQs, and I think that was the case with many of the original children that Kanner saw, and so what you had was children who were just so advanced in their thinking that they didn't fit into the world of other children because they were basically already at sort of college level in terms of their ability to analyze things. So Marcia Hines, going back to her son Ryan, and she wrote this book, We Know You're in There, and she's had this son who was only a toddler, and he was picking up cereal boxes and he was dumping them and the contents out all over the floor. And it wasn't until he was older and able to communicate with her that she found out that he was doing experiments. He was actually doing volume experiments.
Oh my gosh.
She was floored at how he would be able to figure out the volume of things so easily, and it was that he was learning about that by pouring things out and seeing. They knew how much volume it was in that box, and they poured it into something else, and so what we think of is just a child who's just making a mess could be an act of genius,
and yet their actions get misinterpreted every day.
That's right. Their actions get misinterpreted. And so one of the things that people like to point to is they'll say, well, that they think that Einstein was on the autism spectrum because he had a lot of quirks when it came to social interactions with people, and yet he was one of the major geniuses of the last century. And so people say similar things about Tesla. So I think that the children who come from these extremely bright parents have such an amazing ability that they're really not. It's not appropriate for them to just be put into our standard school situation because they don't really have the same kind of interests as other children, and yet it's not that they're not interested. It's not that they're not capable of engaging. So that's one group of children that I think they're really geniuses. They're being mislabeled. Then there are children who have the regressive form of autism that are also geniuses, but their brain's ability to express language was what was affected, but that's just their expression of language, and everything else is perfectly intact, and they had extremely bright parents, and if you help them to acquire language, which there are ways in which parents can help a child to learn how to do so. That's what Akil of the Akil Autism Foundation, I mean, he's learned how to type independently.
Yeah, with assistive technology nowadays, I mean, the biggest example for me, even though he was not a person with autism, he had other physical challenges, was Stephen Hawking. Can you imagine? Even though he was not the way he was from birth, still, in many years ago, someone like that might have been institutionalized. Can you imagine what this world would have missed out on if someone like that, with that incredible level of intelligence and insight and that amazing brain he had, we would have missed out on all of that without his ability to express himself and reach out to us and our desire to reach back to him. Society gave him the chance, and assistive technology gave him the opportunity to do that. And nowadays, making that available to all of these incredible young people who have so much to say and so much to give, I think is so very important.
It is, and I think that one of the reasons why Stephen Hawking received the assistance that he did was that he was already a student in college before he developed the ALS that rendered him paralyzed. And so people knew that he had a mind, and they knew that the nature of his condition was such that it just affected his motor system. And so a similar understanding needs to happen when it comes to these nonverbal children. So many of them, that their IQ is totally intact, they're brilliant, but controlling their body is an issue. And they're now coming up with the technology we have today, they're now coming up with ways in which they can assist people with autism. I saw something just the other day where somebody come up with using smart glasses to help people with autism, and where they're actually using an app that will recognize facial expressions and use an emoji for the child to be able to see, okay, so this person's happy with me. Or this person's unhappy with me, so that because there's just so much variation in terms of people's expression of emotions, and some of that sometimes is lost on these children. And then someone else is coming up with that they're using the fact that language is specific language is encoded fairly in specific ways in the brain, and so they're actually looking at using electronic chips or to actually read your thoughts and then communicate them for you. So it's like bypassing in the voice recognition system, or you have to speak into something to then have it type for you. Actually, just bypassing that and just having the thought and having the technology type it out.
In fact, I have seen some movies. What movie was that? It's an old movie. An old Clint Eastwood movie or something like that called Firefox, was it? I'm trying to remember, but it was that type of technology that they were using on a military basis, where basically a pilot would wear this particular gear on his head, and this technology would read his thoughts or her thoughts that would then be translated to the actions of the airplane that they were flying. And so, and a lot of these sci-fi kind of things that we see portrayed in film and so forth is actually based on real technology that is being developed or been developed, and it just takes a while for it to filter down into the general population and become generally available as you're describing. But it's wonderful to hear that that's actually happening, because I think that will be an amazing breakthrough when that becomes more widely available. That would be wonderful.
Yes, and I mean, there was somebody who was able to, a quadriplegic person was able to, like you said, basically operate a flight simulator.
There you go. So what are some other ways that we haven't mentioned yet that we can help people with special needs make us aware of their thoughts and needs when communication is a challenge? And are there some simple things that can be done on a day-to-day basis that can support and help them in this regard?
Well, I've been looking into this technology called rapid prompting method, and I have seen that has been a key that's unlocked this for so many children, where they basically, the way to think about it is that their primary problem is motor control, and the musculature of the mouth and the tongue and everything is so complicated that trying to get the child to speak is a much larger task than trying to help the child learn how to type. And so with rapid prompting method, what you're doing is you're teaching them how to type, but you're starting off with something that they can do, which is they can point to, depending upon how good their aim is, it may be that they can only be accurate within 3 inches. So then you basically have to have a large letter board, so that they can point to the different letters and which letter they're pointing to. And then So you're teaching them how to communicate by making it easier for them, and so then they can point to the letters, and then they get rewarded because they see, wow, you understand what I'm saying. And so then and you're also at the same time training their coordination, and so their coordination gets better and better, and they can start being more precise in their movements to get down to the point where they can actually, with still getting some typos, but they can hit the key on their keyboard and be able to use a computer.
That sounds great. I mean, that sounds like a wonderful method to assist people who are challenged with communication in that way. Is there anything else that you would like to add that we haven't gone over yet? And what do you think is the most important takeaway for our listeners to remember from our conversation?
I would say that another thing I wanted to add is that some children, the reason why they're not really engaged in life socially and their language isn't really progressing is because they're physically ill. And so the inflammation that's in their body is affecting them, and it's like they feel like they have the flu. And so if you're physically not feeling well, then how can you meet the demands of life? I mean, anyone who's had the flu or been knocked out by just a really bad viral illness knows that you just don't feel like doing anything. Everything is really hard.
That's true.
So that's the other thing, is that looking at these children and seeing how you can really support their immune system, because one of the things that we know is that there's this interrelationship between the immune system and the brain. The brain has about 10% of the cells in the brain are actually immune cells, and their role is to clean up the connections between neurons that aren't used or that become faulty. And during the process of development, when after a child is born, there's this sculpting of the brain, and it's called pruning, that occurs, and they're removing the unnecessary connections between the neurons that aren't being used or reinforced. And so when that system, which is more easily activated during the first 4 years of life, when that system gets overactivated, it needs to get calmed down. And so you need to find what's the source of that. And so it could be that their gut has what we call a dysbiosis, which means that they don't have the proper bacteria in their gut for manufacturing the chemicals that their body needs and their brain needs to run properly. And so that's one of the reasons why these fecal transplants have received a lot of interest by people, is that if you take the stool, which is full of bacteria, from a child or a person that doesn't have problems, it has actually a fairly diverse population of bacteria in there, and if you actually give that to a child and plant their bowel with these beneficial bacteria, oftentimes, and it's because the bacteria are little chemical factories, and they're also competing with the bacteria that are chemical factories making the stuff we don't want. And so oftentimes, something like that, an innovation like that, is what the child needs. Sometimes what it is that they don't have enough vitamin D, which is essential for the immune system to function properly, and we need to either get vitamin D in our diet or by a supplement or by sunshine. And when you have people increasingly living indoors, you have an increasing number of people who are vitamin D deficient. And that has many consequences, and consequences in terms of one's mood and consequences in terms of one's immune system. So getting children outdoors and so that they get enough vitamin D, and looking at their diet. Some of the processed foods are problematic. A lot of children are having reactions to the proteins that are in our milk and wheat. There's also things like glyphosate, which some children seem to be susceptible to glyphosate, which is also Roundup. Some children don't have proper detox pathways for clearing it out of their system, and that's why you can have one child who gets really ill by having Roundup being sprayed in the yards around them, and the other children are fine, because some children, their genetic for their detox pathways or their nutritional support for the detox pathways is working. But if you have a child who's got mitochondrial dysfunction because of aluminum toxicity, or because of a genetic mitochondrial disorder, or because they don't have enough of the things that mitochondria need to run properly, then that child doesn't really have that. They're not well equipped to detox. And so what I would say is that if your child is on the spectrum, the takeaway message is that you don't just take that diagnosis as, well, okay, that's the diagnosis, and then as though, like somebody had said, your child has Down syndrome, and so then that means, well, they've got this syndrome, and there's nothing that can be done, which is how most people think of autism. They not only make the mistake of thinking that it's associated with a low IQ, but they also make the mistake of thinking, well, this is like a fixed thing, that there really isn't any help for this child. You can just at best manage things. And the reality is that a lot of these children can improve in terms of their ability to function, and a lot of them have tremendous gifts that it's so rewarding for the parents to be able to see in a child that they think, that they've gone a period of time of thinking, well, my child's probably not going to be able to do anything, and then when they start to see that there is hope, that their child actually contains gifts, and oftentimes they contain gifts that are ones that are just phenomenal. I mean, that's what savant syndrome is, which is something that I study. How is it that somebody like a lot of people think of Rain Man as being autistic. He wasn't. He had hydrocephalus. But those kind of skills where you have someone who just knows everything. They have an amazing memory, or they have incredible artistic or musical skills. There's so many cases of people with autism who just blow people away by the skills that they have. And so oftentimes the very thing that makes them slightly different also gives them this unique perspective on things, or this unique ability that may not be there otherwise. So I think we need to look at each child differently and look at what cofactors might be playing a role in the syndrome, see what happens if you address those cofactors, and do what you can to get treatments investigated, to have clinical trials and to have treatments approved so that they become affordable, because so many of these things that I'm mentioning are still in the stage where parents have to come up with a way of paying for it out of their own pocket.
That's so true. That's so true, and that's so sad. And I agree with you entirely, and it's great to hear you say these things, because I know I have heard myself that the gut is like the second brain. And so many of these people who are on the spectrum, or who are people with autism, have gastrointestinal issues. And it's so interesting to hear you talk about the different links and causalities that are there, and just doing simple things, like you said, like getting the person out into the sunshine more often, making sure that they spend time outdoors, supplementing their diet with the appropriate things, maybe giving them some probiotics. If fecal transplants or whatever are not possible, or your insurance won't pay for it, you can't afford it, there are other ways as well to try and support and assist that don't have to be super expensive, don't have to cost a lot of money or be out of someone's reach. And I think that taking this outside the box, more creative approach to supporting these young people and these individuals with autism is such an important perspective to take, and such an important step to take in terms of making sure that your loved one, or whoever it happens to be, reaches their full potential, because they can. They just need our help, but they certainly can.
That's right. And then a couple of other things that I didn't mention that are also things that I've discovered that are helpful is that I've had this happen with several children now, where they were really struggling in school, had all kinds of anxiety around it, and what they have been suffering from, and it was really not picked up by anybody, was something called convergence insufficiency. And what this is a byproduct of the fact that we're increasingly living indoors, and that we are that so much of our visual process is directed towards looking at something that's very close to the face, and maybe, in an indoor setting where maybe we're only looking 20 feet away from us at a wall, and or we're looking at a book or a computer screen. And so when you're not having the opportunity to be outdoors and look at the horizon, it's actually affecting the development of the eye. And so their depth perception is not what it should be. And because it's affecting their depth perception, it's affecting their ability to properly see things when they're coming at them. So they get startled more easily by because it's our depth perception that helps us to, without even consciously thinking it out, get a sense of, when's something going to come to us, and when do we catch that ball? How do we catch that ball? And so you've got a sense of, how it's traveling, because of our depth perception, we're seeing it coming towards us. But if your eyes haven't developed properly, then you have problems with that, and you have problems with reading and getting your eyes to cooperate and coordinate together. So what's happened is that I've recommended to the mothers of these children that they get them some glasses to try. First of all, get visual testing for convergence insufficiency, and then if they have it, to try these glasses. And it has helped these children tremendously. I mean, it's like they love their glasses now, and they can do their schoolwork. And so I think that if your child's young enough that their eyes are still developing, getting them outside, trying to get it so that they can see the horizon, just helping to assist them that way. But then also if they're struggling in school, have their vision checked.
That's a great pointer, Diane. That's great advice. And I absolutely agree with you, because I know I've experienced something very similar with my own son. So I can attest to that personally, that is something very, very important to pay attention to. Well, this conversation has been absolutely fascinating. And please tell us, how can the listeners reach out to you if they have questions or they want to know more?
They can go to my website, which is drdianehennacy.com. So it's drdianehennacy.com. And they can find out more about the work that we're doing with autism. They can find out more about the research I'm doing on telepathy in autism, which is something really interesting, that these children who are born, I found that it's the children predominantly who have their ability to express themselves taken away at a young age, that they're the ones who seem to be the most capable of understanding what it is that their mother is thinking, or whoever their primary caregiver in their life is, that who that person, what that person is thinking. And it's fascinating to see this. That it's some people find this frightening, but to me, it's happening because you have a desire on the part of both parties to be in communication with one another, and it's, I think, a natural part of development. I think that when we're first born as babies, that we may all have this capacity. It may be what assists us in developing language, and then once we develop language, it drops out. So it's actually a statement about how precious that bond is. That they really want to know. They don't view you as an object, or that the reason why they're not looking at, if they don't have good eye contact, the reason why they're not looking at you has nothing to do with whether or not they care about you or love you. It oftentimes has to do with the fact that it's hard for them to actually look at you. And once again, that could be something going on with their eyes. It could be a lot of the children have the convergence insufficiency. It causes them to have, what feels like permanent double vision. And so just imagine, trying to navigate this world with what's like double vision all the time. And so I think that we need to really try to understand these children and know that there's nothing to be afraid of here. That what they're showing us about human potential and about who they are is so to me, it's uplifting. When I see some of the things that these children have to say, they've even though they've been given, a lot of them have, they have a tough life, dealing with their bodies and whatnot. They, for the most part, when they're getting loving, from family and whatnot, that's the main thing that matters to them. And in terms of their development as human beings, they are they talk about how they don't understand why we don't get along better, and why don't people treat other better, why aren't we kinder, and all of these things. It's like they're these little, very advanced beings, that are here really trying to get us to slow down and really look at what does it mean to be human, and what does it mean to relate to one another.
That is absolutely beautiful, and I find it fascinating and uplifting as well. I don't find it frightening at all. In fact, I find it incredibly intriguing, and I would love to invite you back to talk more about your research with these children and with these parents, and with the mental telepathy that takes place between them, and everything that you were just describing. I would like to extend that invitation to you to come back and discuss that more at some point, because I think that is definitely something that is important to share.
Well, thank you. Yeah, it's a privilege to be in this position, to be able to be doing this kind of work, because it is, to me, we're living at a critical time period right now, and anything that we can do to really get us back on track is, and to the extent that what these children are showing us can get us back on track as spiritual beings, is, to me, it's an honor to be able to even participate in that.
I agree with you, and I want to thank you again, Diane, so much for your time and the wonderful information that you've shared today.
Oh, well, thank you. It's been a pleasure, and I'd be delighted to come back.
I also want to thank our listeners for spending a part of their day with us. I'm Gilda Evans, reminding you to take care of yourself and that special person in your life.